Hello friends, let us now learn some important points about hypersensitivity reactions. Hypersensitivity reaction classification into 1, 2, 3 and 4 and 5 is by Gell and Coombs classification. With Gell and Coombs classification, hypersensitivity reactions are divided into 1, 2, 3, 4. 4 is recently added. So 1, 2 and among all these 1, 2, 3 are antibody mediated, whereas 4 is mainly cell mediated. So first we will see about the hypersensitivity reaction 1. In hypersensitivity reaction 1, first there will be an allergen. Okay, this allergen will be first presented on the antigen presenting cells with MHC. Okay, so this will go and enter the antigen presenting cell. So this antigen, this will present the, and this is antigen presenting cell, this will present it to its MHC. Now this antigen presenting cell is activated by the T cell, by its T cell receptor. This is the T cell receptor. With this the T cell is activated. This will lead to the activation of T helper 2 cell. This T helper 2 cell will produce interleukin 4 and interleukin 15 and also interleukin 13. It produces interleukin 4, 13 and 15. This interleukin 4 will now activate B cells, and these B cells will produce plasma cells, and these plasma cells result in formation of IgE antibody. Now IgE antibody is formed in the body. This IgE antibody will go and attach to the mast cells. Okay, on the mast cells the IgE antibody will attach like this. Okay, once the IgE antibody will attach on the mast cells, this is called as sensitized mast cells. Okay, now if the antigen gets into our blood again, so this is second exposure, second time if the antigen gets into our blood, now this antigen is recognized by the mast cell and it undergoes polymerization. Okay, once the antigen has polymerized between the two IgE antibodies, so this will result in a release of histamine. Okay, histamine and serotonin are released. Okay, these are preformed mediators which are released, and also the other mediators like platelet activating factor, arachidonic acid metabolites are also newly synthesized. So if you see the one-liners in type 1 hypersensitivity reaction, most important cell is mast cell, but most important cell in the late phase is eosinophil. So examples of type 1 hypersensitivity reactions include, this is any types of allergy like allergic rhinitis, allergic dermatitis, allergic conjunctivitis or atopy, bronchial asthma, Cassoni test which is done in Echinococcus granulosus, drugs like penicillin allergy are the examples of hypersensitivity reaction. What is the drug of choice for type 1 hypersensitivity reaction? You can give mast cell in stabilizers like olapatidine, or antihistaminics can also be given. Next we have type 2 hypersensitivity reaction. So first we will see the examples of type 2 hypersensitivity reaction. Examples are, it is myasthenia gravis, blood transfusion reactions, Graves disease, immunohemolytic anemia, idiopathic thrombocytopenic purpura, Rh incompatibility, rheumatic heart disease, then pemphigus and pernicious anemia. I remember this has all the things related to blood with myasthenia gravis, Graves disease and pemphigus. See, blood transfusion reactions, immune hemolytic anemia, idiopathic thrombocytopenic purpura, Rh incompatibility, okay, and pernicious anemia. All these are those related to blood. Along with that, rheumatic heart disease, pemphigus, Graves disease and myasthenia gravis are type 2 hypersensitivity reactions. Now this type 2 hypersensitivity reaction is mainly of 3 types. We have three types of type 2 hypersensitivity reaction, which are mainly immune complex formation. It has three phases actually. It is an immune type 2 hypersensitivity reaction. In type 2 hypersensitivity reaction, it is antibody dependent cell cytotoxicity will be there. In type 2 hypersensitivity reaction, there is antibody dependent cell cytotoxicity, and even NK cell destruction will also occur by type 2 hypersensitivity reaction. And we have type 3 hypersensitivity reaction. In type 3 hypersensitivity reaction, it includes mainly the immune complex disease. This immune complex disease have three phases. First, there should be immune complex formation. Then there should be immune complex deposition. Then once the immune complex is deposited in the cell, this will activate the complement system, thus resulting in hypersensitivity reaction. So this is type 3 hypersensitivity reaction. Examples include SLE, serum sickness, Skick test. Skick test is done in Corynebacterium diphtheria, Henox conline purpura, Arthus reaction, Raji cell assay. Then we have post-streptococcal glomerulonephritis, polyarteritis nodosa, and all the some of the parasitic diseases like malaria, which is leading to the formation of nephrotic syndrome. So all these are the symptoms, all these are the examples of type 3 hypersensitivity reaction, which are serum sickness, serum SLE, serum sickness, Skick test, Henox conline purpura, Arthus reaction, Raji assay, then post-streptococcal glomerulonephritis, polyarteritis nodosa, parasites. In the parasites, we have malaria like causing nephrotic syndrome. So this is type 3 hypersensitivity reaction. Then if you see the type 4 hypersensitivity reaction, this is cell mediated or delayed type of hypersensitivity reaction. Here, whenever there is antigen is present, this antigen will first be presented by the antigen presenting cell to the T cell. So this antigen presenting cell is presented by the MHC to the T cells where there is T cell receptor. Now thus this will result in activation of T helper 1 cell. So in T2, that is in first type of hypersensitivity reaction, T helper 2 cell is activated. Now T helper 1 cell is activated, resulting in the formation of interferon gamma, interleukin 2 and tumor necrosis factor beta. This will result in the formation of chronic inflammation slowly, and leading to the formation of granuloma will occur. In some cases, not in all, but in some cases. So examples of the type 4 hypersensitivity reactions are, there is formation of granuloma, and some skin tests like Montauk's test, which is done for tuberculosis, then Lepromin test, which is done for leprosy, and Montenegro test, which is done for the leishmaniasis, and it also includes contact dermatitis. So these are the type 4 hypersensitivity reactions. Okay, what are the causes of this contact dermatitis? This contact dermatitis, if you see in the world, it is caused by poison ivy, whereas in India it is caused by detergents and artificial jewelry. It is caused by detergents and usage of artificial jewelry results in contact dermatitis. Now recently type 5 hypersensitivity reaction has been determined. This type 5 hypersensitivity reaction is actually a type of type 2 hypersensitivity reaction, which is antibody against the cellular receptor. whenever the antibody is produced against the cellular receptor. I will tell you an example which you can understand. So if you see myasthenia gravis, in myasthenia gravis the antibodies are produced against the nicotinic receptors present in our body. In our body we have nicotinic receptors which will bind with acetylcholine. Now the antibodies are produced which will destroy this nicotinic receptors. So this myasthenia gravis, in this the antibodies are produced against this cellular receptor, thus destroying it. So this is type 5 hypersensitivity reaction. This is also seen in Graves' disease also. So these are the important type 5 hypersensitivity reactions. So if you see, we have some important questions. In rheumatoid arthritis, we have both type 3 and type 4 hypersensitivity reaction. But type 4 hypersensitivity reaction is more common in rheumatoid arthritis. Then if you see in hypersensitivity pneumonia, we have both type 3 and type 4. Then very important questions are transplant rejection. In transplant rejection, in hyperacute transplant rejection, it is type 2 hypersensitivity reaction. In acute transplant rejection, it includes 2+4 hypersensitivity reaction. In chronic transplant rejection, it also includes 2+4 hypersensitivity reactions. Okay, so these are the important questions. And if you see in SLE, there is type 2+3 hypersensitivity reaction is seen in SLE. So these are combined hypersensitivity reactions which are seen. Thank you for watching.